Brain tumors. Primary intracranial neoplasms are the result of proliferation of normal cells within the CNS, central nervous system. These include tumors of the brain itself, the skull or meninges, the pituitary gland, and the blood vessels. CNS tumors may also consist of metastatic tumors that spread from systemic organs. Primary CNS tumors only rarely metastasize outside the CNS. Pathophysiology and etiology may originate in the CNS or metastasize from tumors elsewhere in the body. May be benign or malignant. All produce effects of space-occupying lesion, edema, increased ICP. Malignancy may be related not to cell type or invasiveness, but rather to location and inoperability. May arise from any tissue of CNS, 40 to 50% of intracranial neoplasms and gliomas. Astrocytoma arising from connective tissue of the brain. Astrocytes, highly invasive, poorly marginated, grades 1 and 2. Glioblastoma, grade 3 and 4 astrocytomas, highly invasive, infiltrative, poorly marginated. Oligodendrogliomas arise from the frontal and temporal lobes of the cerebrum. Ependymoma and medulloblastoma. Colloid cysts develop within lateral or third ventricles. Meningioma arising from linings of the brain. Acoustic neuroma develops in or on the 8th cranial nerve. Metastatic lesions commonly from lung and breast cancer, usually multiple and unresectable. Developmental tumors, dermoid and epidermoid cyst, craniopharyngioma, pituitary or pineal teratoma. Hemangioma, that is angioma from blood vessels of the brain. Malignant tumors, chondrosarcoma, osteogenetic sarcoma, fibrosarcoma or chordoma account for 2% of all cancer deaths each year, second most common malignancy in children. Clinical manifestations depend on tumor location and biologic nature of the tumor. If the tumor is a non-eloquent area of the brain or slow growing, specific symptoms may not develop until the late stages of the process. Instead, the tumor may produce generalized symptoms related to the increasing size of the tumor and the expanding area of cerebral edema surrounding the margins of the tumor. This is referred to as mass effect of the tumor. Number 1, generalized symptoms due to increased ICP, headache, especially in the morning, vomiting, papilledema, malaise, altered cognition and consciousness. Number 2, focal neurologic deficits related to region of the tumor. If it is in parietal area, sensory alterations, speech and memory disturbances, neglect, visuospatial defects, right-left confusion, depression. Visuospatial effects, VISUOSPATIAL, visuospatial effects. If it is in frontal lobe, personality, behavior and memory changes, contralateral motor weaknesses, Broca's aphasia. If it is in temporal area, memory disturbances, auditory hallucinations, Wernicke's aphasia, complex partial seizures, visual field deficits. If it is in occipital area, visual agnosia and visual field deficits. In cerebellar area, coordination, gait and balance disturbances, dysarthria. If it is in brainstem, dysphagia, incontinence, cardiovascular instability, respiratory depression, coma, cranial nerve dysfunction. If it is in hypothalamus, loss of temperature control, diabetes insipidus and SIADH. Pituitary cell turcica, visual field deficits, amenorrhea, galactorrhea, impotence, Cushingoid symptoms, elevated growth hormone, panhypopituitarism. Referred symptoms related to vasogenic edema of the tumor presence usually present symptoms of ischemia of the region distal to the actual lesion. Last one, seizures. Diagnostic evaluation, skull radiographs to determine bone involvement, identify pineal shift, helpful in children. CT with or without contrast to visualize tumor, hemorrhage, shift of midline, cerebral edema. EEG to detect locus of irritability. Lumbar puncture for elevated CSF protein cytology, risk of herniation if intracranial pressure is increased. Angiogram to detect vascular tumor. Cerebral blood flow studies to follow progression of tumor. MRI to visualize tumor, more useful than CT in posterior fossa evaluation. Stereotactic biopsy or surgery needed for definitive diagnosis and cell type. Management, effectiveness of treatment depends on tumor type and location. Capsulation or infiltrative status. Tumors in vital areas such as brainstem and non-encapsulated and infiltrating tumors may not be surgically accessible, and treatment may produce severe neurologic deficits like blindness, paralysis, mental impairment. Treatment is usually multimodal. Surgery, removal or bulking by the way of craniotomy, laser resection and ultrasonic aspiration. Craniotomy is treatment of choice for most tumors, although about 10% are inoperable. Laser resection and ultrasonic aspiration may augment surgical resection. Radiation therapy, external radiation to tumor bed with 2 cm border. Conventional therapy daily for 6 weeks, shorter to brainstem. Prophylactic radiation to brainstem for other brain tumors with high risk of metastasis. Brachytherapy, you can use radioisotopes implanted through interstitial catheters to permit high doses for high-grade malignant tumors. Radiosurgery. Stereotactic radiosurgery by the way of Linax scalpel or gamma knife delivers a single high dose of radiation to a precisely targeted tumor area. Destroys only abnormal tissue, limiting damage to surrounding brain tissue. Chemotherapy with single or combination drug therapy may require autologous bone marrow transplantation, that is aspirated before chemotherapy and reinfused afterward to treat bone marrow depression. As adjacent to surgery and radiation, many agents do not cross blood-brain barrier. Shunting procedure to manage hydrocephalus, which may be obstructive or non-obstructive depending on location, tumor type, degree of necrosis and associated edema and inflammation. Supportive therapy and medications, anti-epileptic drug therapy and dexamethasone to reduce swelling and reduce radiation edema, also given during the stage of to enhance quality of life. Complications, increased ICP and brain herniation, neurologic deficit from expanding tumor or treatment. Nursing interventions include relieving pain, preventing injury, minimizing anxiety, optimizing nutrition, strengthening and family coping. Thank you.